As it stands, all restrictions on nationals from Turkey, Brazil and South Africa have been lifted, with non-Nigerian passport holders and non-residents who visit Brazil to be allowed into Nigeria. They must, however, comply with the provisional quarantine protocol for travelers arriving in the country. Joining us to talk more about this, Dr. Mukhtar Mohammed, Incident Manager and National COVID-19 Response Center of the Presidential Steering Committee. He joins us now virtually. We'd like to thank you for joining us on the program.
Thank you, Millicent. Good evening.
Good evening. What informed the decision to remove Turkey, Brazil and South Africa from Nigeria's COVID restriction list?
So the COVID-19 situation globally has been a dynamic one. For us in Nigeria, we have reviewed the happening globally and in various countries. These particular countries, about 3 or 4 months ago, had a rise in cases. We've seen increase in the number of cases, increase in positivity rate. We've also seen increase in mortality, hospitalization and mortality in those countries. And because of the high traffic volume between Nigeria and these countries, they constituted a risk for us in terms of importation of the Delta variant. But we've been reviewing the situation every 4 weeks since that time. You recall that in mid-September, we had removed India from the list because we have established that the pandemic is actually subsiding in India, and all the parameters that we were monitoring have actually turned out to be low. So last week, we also took a very deep review of what is happening in the remaining countries, Brazil, Turkey, and South Africa. And we have seen consistently that over the last 4 weeks, particularly South Africa, the number of cases has gone down, their positivity rate has also gone down, and most importantly, their vaccination coverage. The same thing applies to Brazil. Turkey had a little spike in the number of cases, but if you look at it on average also, the number of cases has gone down, their vaccination coverage has also improved, and therefore they no longer constitute the risk as we imagined for the importation of the Delta variant. Besides, in our own country now, over 90% of all new cases are actually the Delta variant. So really there is no need to continue to do that restriction. This does not mean that we have completely banished our so-called red list or the restricted countries list. It is still there. We are going to do another evaluation very soon, and we will determine the risk of importation of either Delta or new variants into the country.
Dr. Mohammed, you said
which countries will fall.
Yes, you said the red list. Are there any other countries on the red list at the moment? And for these countries that have been removed from Nigeria's red list, what is the procedure now? Will they still have to be quarantined, the 7 days mandatory isolation? What now exists?
So we still have, the red list is not banished completely. But for now, we don't have any country that satisfied the criteria. For these countries now, the implication is that they have been classified as the rest of the world with other countries. And that means if they are coming in, they will follow the normal protocol that every traveler to Nigeria will now comply with. And for now, our new protocol distinguishes between people who are fully vaccinated and people who are not fully vaccinated. People who are fully vaccinated are expected to have a PCR test at least 48 hours before they board to come to Nigeria. And when they arrive, they are also expected to take another PCR test within 48 hours to determine if they are infected or not. After that, they are now free to move to do their interaction in the society. And that is it. For people who are unvaccinated, it is different. People who are unvaccinated or people who are partially vaccinated will need to do the PCR before they arrive the country at least 48 hours. And they also need to do a day 2 testing upon arrival in the country. They need to isolate for 7 days, and then they will need to do an exit test at day 7 to confirm that they actually are COVID-19 free.
Finally, Dr. Mohammed, on the issue of the vaccine mandates, especially to federal workers, isn't the deadline December 1 a little premature, seeing as how slow we're having vaccines come into Africa, talk less of Nigeria?
Our rate-limiting step for vaccination was the availability of the vaccines. But for now, we've been guaranteed that we have adequate quantities of vaccines in the country. We have the Moderna vaccine, we have Oxford AstraZeneca, and the distribution has also been done to all states of the Federation. So vaccine availability now is no longer the challenge that we face. What we need to do is to come out en masse and make sure that we mobilize people to take these vaccines. Vaccine hesitancy for now is our greatest stumbling block to achieving herd immunity in the country. And the federal government now, after all considerations, decided that really we have to begin this vaccine mandate, particularly with the federal workers, so that we mitigate the risk, we reduce the risk around our offices, because people who are unvaccinated actually constitute a risk to other people and even to people who are vaccinated.
All right, we'd like to appreciate your time on the program. Thank you so much, Dr. Mohammed, Incident Manager, National COVID-19 Response Center of the Presidential Steering Committee. Thank you for joining us on the program.
Thank you, it's my pleasure.
Still ahead, travelers react to South Africa's removal from Nigeria's COVID-19 restriction list. Please stay with us.